Hello, Dr. Errikos Maslias, and welcome to the 8th European Congress of Neurorehabilitation. The ECNR brings together scientific and clinical communities. What do you believe is the unique role it plays in bridging the gap between research and daily patient care in neurorehabilitation?
So thank you, I'm very glad to be here. I think that clinical and research parts in medicine are very related, because research comes from questions that arise during clinical practice, and then clinical practice improves with the research results. So I think that's very important, and the ECNR Congress bringing people together from different domains, different specialties, some of them doing only research, some of them doing clinics, and some of them doing both. I think that's a very important thing that bridges this gap between clinics and research.
Yes. Considering your specialty, what future developments do you envision for the complex multidisciplinary field of neurorehabilitation?
So I think it's a very exciting period for neurorehabilitation. We have many new improvements, we have new technologies, but also we have a paradigm shifts when we want to start neurorehabilitation earlier and more intensively. So I think it's a very exciting period, and I think for the future directions, what we should do is start neurorehabilitation earlier, more intensively, which can be a challenge because it's multidisciplinary, so every work can be different for physiotherapists, for ergotherapists, speech and language therapists, nurses, so everyone has to change this paradigm shift.
Is there a specific technology that you are excited to see in the...
So of course, artificial intelligence, I think it has many potentials. It can handle enormous data and figure out patterns that cannot be done by human power. And also, for example, in disorders of consciousness, artificial intelligence could identify more subtle signs for clinical examination that are often missed by the human eye, and that I think can improve our practice in the intensive care unit as well.
And what is, from your perspective, the most challenging future development in neurorehabilitation, and how can the FNR come closer to this endeavor to bridge the gap?
So I think the challenge is quite related to the progress. So now we have a lot of technology, we use a lot of neuroimaging, paraclinical techniques. I think a challenge is to stay, however, clinical, to do clinical assessment of our patients, and I think that this is something that should be also taught to young doctors that start the specialty as me. And what maybe the FNR could do is workshops on clinical practice, clinical knowledge on how to properly examine patients. That can be patients with brain lesions and specifically patients in coma as well.
Your career path combines clinical neurology in neurorehabilitation and digital technologies. Based on this perspective, what do you see as the most critical element that should be solved or addressed?
Mm-hmm. So I think that in these different fields we have different challenges. One of them is international collaborations. We should collaborate more in between countries to have common definitions, common flowcharts on how to examine patients and do more collective studies, multicentric studies with more patients, as neurorehabilitation studies are often limited for many different reasons, and I think we should concentrate on this.
Right. Thank you so much for being here.
Thank you very much.